And I am the communication specialist here at SAS. SAS is we are a provincial nonprofit organization that works collaboratively with member agencies, with community partners and governments across Saskatchewan, all who advocate and provide services for survivors of sexual violence in the province. Today, we are coming together as part of Sexual Violence Awareness Week. So this week we have been leading a campaign called Champions for Children. Our aim for this campaign is to create a culture of belief surrounding child sexual abuse in the province, with the hopes to educate and empower those who care for children, those who are interested in the well-being of children, to not only learn about what it is that we can do in creating a safe space and developing that place of safety and trust for children if they are looking for someone to disclose a child abuse experience, and also learning to understand our responsibility and our duty to report if we suspect or if a child does disclose child abuse to us as well. So Lisa is going to share more on that, but before I introduce her, I would like to acknowledge that we are gathering here today on Treaty 4. It is the original homelands of the Saulteaux, Dakota, Lakota, Nakota, Cree, and Métis nations. We acknowledge our settler relationships to this land, and we are committed to listening, learning, unlearning, healing towards a future of truth and reconciliation. So without further ado, I am going to introduce Lise. Dr. Lise Milne is an assistant professor at the University of Regina in the Faculty of Social Work, Saskatoon Campus, faculty associate at the Social Policy Research Centre, the McGill Centre for Research on Child and Families, and the University of Regina Child Trauma Research. She has 15 years of experience in child welfare in both Manitoba and Quebec as a child welfare worker, supervisor, and trainer. Her research focuses on trauma-informed practices in child-serving organizations, the neurobiological impacts of trauma, and practice and policy responses to intimate partner violence. In her presentation with us today, she will explore the characteristics of child sexual abuse, including the signs and symptoms, the scope of the problem, potential short and long-term impacts across multiple domains, as well as the evidence-based approaches to intervening and supporting child and adolescent survivors. It will also follow by a brief discussion about the University of Regina Child Trauma Research Centre, which collaborates with and provides resources for organizations that support child and adolescent survivors of violence and trauma. So I'm going to pass things over to Lise.
Oops, so now it's disabled.
Let's give this a try here. Does that work?
Let's see. Yes, it does.
There we go.
Well, thank you. I'll just get my presentation going here. And here we go. Okay, thank you, Ashley, and thanks so much to Patience for this invitation to come and talk to you today. And thank you, everyone, for spending your lunch hour with me. I really appreciate it. I don't mind if you eat in front of me. And I appreciate I'm coming here from Treaty 6 territory. And so I wanted to situate myself a little bit first. As Ashley mentioned, I have a background in child protection. I worked for about 15 years in 2 different provinces, so in Manitoba and in Quebec. And so over those years, I did work with many cases of child sexual abuse. And so some of these cases were direct reports of abuse about a child. But many of the families that I was involved in, I also heard many stories about child sexual abuse that were not directly related to the report that was made, but where the child had experienced something in the past, or many caregivers themselves had experienced sexual abuse in the past. And these are really challenging situations to manage, as many of you know who work in this field. And even in the child welfare world, some of the individuals, would feel very comfortable dealing with really challenging cases and had a lot of sensitivity around dealing in child sexual abuse cases. There's still something about this type of abuse that is really difficult for people to manage. And so what we realized is we were sort of limited in terms of the training that was provided so that we could feel confident in our investigations and in our interventions around child sexual abuse. And so we developed a training for workers, for managers and supervisors as well in regards to that. And then when I went on to my next phase of life at the McGill Centre for Research, I became closely involved with a group for about, I would say 10 years, a clinical integration group on child sexual abuse. And so it was great for me to be able to stay in contact with the practice world, but I was this time able to bring research into practice. And I think that's one of the biggest limitations as practitioners. We don't always have time to access research. And so I was able to learn quite a bit that informed child sexual abuse as an issue for me so much more. And I ended up doing my master's thesis in this area. So on child sexual abuse amongst youth in out-of-home care, specifically group care. And so I wanted to add, though, that one of the main reasons, and I think it's the reason I went into social work to begin with, was because I had so many people, probably like many of you around me in my own life, who were survivors of sexual abuse. And I will, try throughout the presentation to intersperse some examples of cases and some examples of, people that were close to me who experienced this. And so it really, because the abuse had happened in so many different contexts, and because the outcomes were so different, I find, it's really important to kind of, be able to provide a really broad picture of this diversity of responses. And just to, for all of us that are paying attention to here, it's because it's important to us as an issue. Okay, and so I think Ashley did a great job of talking about what I'm going to talk about today. So just really covering three main areas around background, the scope and impacts of this problem, and some promising approaches. I do want to explain I'm not a therapist. There may be some therapists here, and I absolutely look forward to questions at the end. I look forward to hearing the expertise of people who are joining us today who actually provide this therapy. So I come from a slightly different perspective, but I'll try to, what I did for this presentation is I made sure to really look at what the most recent research and make sure that we have some updated information to share with you today. And I also want the caveat as well that I know a lot of you know a lot about this topic. I just don't think it ever hurts for us to hear the reminders. And for those who are less familiar, hopefully there'll be some good takeaways from today. So I've selected these images for these sections actually carefully to reflect kind of what I think the sections are about. In terms of the definitions of child sexual abuse, I think we can all agree that it's a form of maltreatment that's recognized across the world as a serious human rights violation and a serious major public health concern. And we'll talk about that a bit later, but trauma itself is considered the leading cause of every serious physical health problem later in life. And so sexual abuse is a big part of this trauma that we're talking about. So I talked about recent research, but I think even if we go back to Putnam's definition back in 2003, I think it really does a good job of covering what we mean. So really sexual abuse being any sexual activity perpetrated against a minor by threat, force, intimidation, or manipulation. The array of sexual activities includes fondling, which is touching on different parts of the body, inviting a child to touch or be touched sexually, intercourse, rape, or involving a child in prostitution or pornography. And I'm just adding here online sexual exploitation because I think this is a more recent phenomenon. This is definitely something that we need to pay attention to, especially during this period of COVID-19. I will mention though that definitions vary and that there's still some disagreement, and that the fact that there are so many, there's so much disagreement about definitions has created some issues in terms of measurement. I looked at a resource that mentioned that when you're talking to kids about it, you can also explain it by saying when someone does something sexual to you or with you, which you are not mature enough for, that you're not capable of choosing yourself, and if you're drunk, asleep, assaulted, threatened, lured, deceived, or restrained. And so I think this is really important because these are the issues that actually lead to so much of the self-blame and the guilt and the shame that survivors experience. So what are some signs and symptoms? So I'm going to talk now about signs and symptoms with the awareness that there's a lot of overlap with impacts. Okay, so we'll talk more about the kind of the evidence-based impacts of child sexual abuse, but these are some signs and symptoms, so things that you can look for in your work or in your personal lives. But I really want to stress, and I'm going to keep stressing it, that these are unexplained problems, right? So many of these issues are not related to child sexual abuse, so it's really in the context of when you cannot explain this in any other way. So some psychosocial problems like behavioral problems, and this is what we see with so many children who enter the child welfare system, especially our out-of-home care, group care system. So acting out, behaviors that are risky or harmful to themselves or others. This could be problematic drug or alcohol use, running away, what we call non-suicidal self-injury, so people who are cutting themselves or harming themselves in other ways, or suicidality. I want to stop here and I want to mention that Christina, thank you very much. You mentioned in the chat, but for those that didn't see it, this will be a triggering presentation. And so I'll appreciate if people need to tune out a little bit or leave the presentation because it can be very, very heavy material for people to hear. And I absolutely appreciate that. So in terms of psychological problems, some irrational fears that children or adolescents are exhibiting, symptoms of post-traumatic stress, which is one of the more common reactions to child sexual abuse, unusual depressed attitudes, anxious, or some dissociation, so where a child or adolescent will kind of fade away or just appear to really tune out. Some physical symptoms, again, unexplained, changes in sleep patterns, some somatic complaints, and one of the very, very common ones is pains within the stomach. So there are gastro, kind of intestinal impacts of sexual abuse that can be from stress or from the abuse itself. And then one of the more severe, but much less common, even in cases of extreme abuse, injury in genital or anal areas. And so this is a more obvious symptom, but it is not always attributed to child sexual abuse. So we have to be really careful with that piece. As well, unexplained sexually transmitted infections or pregnancy. And then probably something that you would see more often is inappropriate sexual knowledge, but we need to consider this is in regards to the child's age and their developmental level, and those are often very different. And I also want to stress that, it's really important for us when we're working with families that we know what the child's knowledge is or should be given what they have been exposed to, because that can make a big difference as well. And then another kind of common concern is inappropriate sexual activity with other children. And so this, again, is something we need to be really careful about because there is very normal, developmentally appropriate sexual play that kids have. And if anyone's interested, I do have a resource that can kind of outline what is appropriate generally at what age. But I want to stress here that sexual abuse of children remains unrecognized in the vast majority of cases. So we don't see signs and symptoms most of the time. And really, this has a lot to do with the fact that kids are not disclosing. They're not disclosing out of things like shame, out of feelings of wanting to keep it secret, either because they've been told it, because they get a sense from the community and society that this isn't something you talk about. Fear of repercussions if they were to disclose, whether it's with their family or whether from the perpetrator themselves. Protecting the family or protecting the perpetrator themselves. And we don't want to admit this, but many survivors love the perpetrator. And really just sometimes even a lack of awareness that the abuse was actually abusive, that it was wrong. And that could be due to age, that could be due to isolation, just a kind of a lack of education or understanding. And again, as I said earlier, some symptoms may not be really specific, and so it's really difficult to tell whether it's an indicator of this type of abuse or it could be something else completely unrelated. So some characteristics of child sexual abuse, that it often occurs with other types of abuse or neglect. And again, this is something that I think we tend to have this, focus on one type of abuse or neglect without recognizing that it's much more common for children and adolescents to experience different types together. And there's a lot of research on this, but I'll just, a couple of studies that I was engaged in. Every youth that reported child sexual abuse reported at least one other type of abuse or neglect, and 75% of the people who had been sexually abused reported other types of maltreatment, all four of the other types that we were measuring, so physical abuse, emotional abuse, and neglect. And so we need to also be thinking about this in the way that, wow, what a complex issue in and of itself to address, never mind alongside these other potential types of maltreatment and possibly other marginalizing factors. One of the main pieces that needs to be impressed and needs to continue to be impressed. And, we've got about 40 or 50 years now of research, and it's, definitely getting better and better. There's definitely less kind of taboo about talking about this than in the past, but there's still is surprisingly lack of understanding that sexual abuse most often occurs with someone the child knows, and often in the family. And this is very difficult for us to accept, because it means that we have to look, inwards, look at our own families and within our own communities. But this idea of stranger danger, we need to obviously keep our kids safe, and it does occur by strangers, but most often it occurs within the family or with someone the child has a very close or trusting relationship with. And I just want to focus specifically on, because sexual abuse does occur within the family, either sibling abuse or in many cases incest, there's some much more severe consequences that can result. And that, I think most of us, if we think about it, make a lot of sense. So, people in the family wanting to deny that it's the case, disruption that's going to occur in the family if this type of abuse is disclosed. It's very different from saying, the guy in the street who came by in the car assaulted me, versus this happened within my own home. The blaming, the stigmatization that can come from the family members or from the community. Legal process get much more complicated around access, around who stays, who goes. And, in some cultural practices, the consequences can be life-threatening, and we've probably heard about some of these situations. And what ends up happening in a lot of these cases is that the children need to find alternative survival strategies, because fighting, flighting, meaning leaving, or disclosing are not relevant options for them. So where you might be able to do that in a different context, some children just don't feel that they're able to do that here. And so there's much more of the kind of freezing, so the dissociating and the sort of freezing and the denying, or acting out the abuse in different ways. Now, I wanted to talk a little bit more about myths. A wonderful review, and most of the research I look at now are reviews or meta-analysis. So they look at a bunch of studies and they look at their quality, and it kind of to bring forward, because there's so much diversity in results, to kind of bring forward, the most commonly reported facts. Speaking of the opposite of facts, a Google search for this particular study found 119 myths related to child sexual abuse. So I've kind of listed them here in 4 different categories. So first is the minimization of the harm that is caused by child sexual abuse. So in cases, for example, of exposure or fondling even, people will look at it as, well, it wasn't violent, and so it's not damaging. The idea that, like other problems in childhood, that kids will just naturally outgrow them, or because someone's doing really well in adulthood, that somehow, the effects haven't persisted. The children seduce adults, and this whole Lolita effect, and if you look back, if you think about, the history, hundreds of years ago, children were actually viewed as small adults. And this is where this whole thing kind of first emerged, that somehow children had this capacity to seduce and manipulate adults, and that they are to blame. This implication of consent. So this idea that if it happened and the individual didn't really try to avoid the situation or fight against the situation, that somehow they consented. And if children were really being harmed, they would definitely say something. And in some cases, the child showed pleasure. and I think this is really important to talk about. It's uncomfortable, but biological responses can be natural. And in some cases, kids have reported feeling pleasure, and that adds to the shame, and that adds to the secrecy around child sexual abuse, but it doesn't make it less harmful. So I'm just giving you an example of just a really surprising situation, this whole teacher-student relationship. This was the case of a 43-year-old female teacher and a 13-year-old boy. So this came back from the Supreme Court. And hopefully we would see something slightly different today, although some of the rulings lately make me question that. But he said, it's just something between these two people that clicked beyond the teacher-student relationship. Maybe it is a way of him to, once this happened, to satisfy his sexual needs. At 13, if you think back, people mature at different ages. We hear of newspapers and TV reports over the last several months of 9-year-olds admitting to having sex. So I really don't see the harm that was done here. I don't see anything here that shows that this young man has been psychologically damaged by her actions. And don't forget, this was mutual consent. And what we've learned along the way is, it's not about clicking. It's not about satisfaction of sexual needs. You can't consent when there's a 30-year difference and you're a young child, even a teenager. And some other myths, sort of the opposite, is denying the extent of child sexual abuse. So the fact that it's rare. We're going to talk about in a minute the actual scope of this problem. That in the cases of incest, that it usually only occurs once. It might, absolutely. There are many situations like that, but more often it occurs frequently. I've never heard about an abuse case in my school, in my community, in this particular sport, and so it doesn't happen here. And I'm going to give you an example here, and this is part of the reason that I was mentioning I kind of went into this field, was I was a good friend of Sheldon Kennedy growing up. And so for those who don't know Sheldon Kennedy, he was a hockey player who played for the Swift Current Broncos. And he eventually went on to play in the NHL, and I knew him from about the age of 14 or 15. And what I can tell you is that it did happen in the sport of hockey. And what we learned later is he was offended against chronically for many, many years, and that his perpetrator, Graham James, had perpetrated the same abuse, not the same, but similar abuse against several other people. And I would venture to guess many others who haven't come forward yet. And we've heard other examples in so many different environments where people assumed it couldn't happen there. This idea that, yes, we might be able to say it is a universal taboo. So of all the things that we can agree on as cultures, we usually agree on this, but that doesn't mean it doesn't happen or that it's not serious as an issue. That the act, going back to that example I gave you, is committed by a female, somehow it can't be sexual abuse. Definitely the profiles are different, and definitely they are committed far less often by females, but it can happen. And that boys can't be sexually abused somehow. That somehow they, especially because of the physiological realities, that if they are engaging in certain types of activities, that they couldn't have been abused, that they were willing participants. Other reasons for minimizing the extent of sexual abuse is the fact that most often kids delay disclosure. Very often people recant their allegations, and very, very often details change. And we're going to talk a little bit in a while about disclosure and why this happens. And quite frankly, police workers, judges, many of us have been informed and continue to be, have been misinformed and continue to be misinformed. And I'm going to give you an example here about a case I was involved in way back, where I had a 9-year-old girl, and by the time we actually reached court, it was 2 years later. The abuse had happened to her when she was 7. Not only did the judge fall asleep during the case and facing us, but they actually called as a witness her teacher to explain to the court that she lied sometimes. And so this somehow impressing that if this child fibs or lies, which many kids do and many adults do, that somehow she wouldn't have been telling the truth about this. And I think it's just really important as well to talk about the fact that disclosure, I'll talk about it in a minute, is a process. it comes in pieces more often than it comes all in one kind of tight, clean disclosure. And we had another case where a young boy talked about being sexually abused by his father. He denied that his father had anally penetrated him. And because of the situation, because the mother had left him and was seeking support for this particular child, we ended up closing the file. But later on, he came back and disclosed that he had in fact been perpetrated. And he just hadn't felt comfortable disclosing or sharing this information because, as you can imagine, it would have been very difficult. And so they couldn't pursue the case because they said he was changing his story. So this is just an example of how we have so much to learn and so far to go in regards to this. And I think we've seen this in the clergy, we've seen this in schools and sports, protecting offenders, because it's more important to have that individual involved in our organization than it is to protect the children. So we've seen that in US colleges, we've seen that in the case of Graham James, where people knew had heard rumors and knew of his offenses and continued to hire him, continued to expose him to a number of different children. And of course, we all know about abuse in the Catholic Church and elsewhere. So other myths, reducing and minimizing the blame towards the perpetrator. Again, the child asked for it, this whole rape culture that we continue to experience, somehow the way you're dressed, or the way you acted, or the fact that you walked alone made it so that you asked for it. The child didn't resist. And so therefore, how could you blame the perpetrator for continuing in the actions? And we all know now that there's a very common freezing mechanism or dissociation that occurs in these situations. That the non-offending caregiver didn't stop it, and somehow that deflects blame off of the offender. So somehow the parent or other caregiver must have condoned it if they didn't stop it, and really focusing our blame on them as opposed to the perpetrator. And it's a very complex issue for non-offending caregivers that I'm happy to talk about later as well. That incest is a family problem and not a particular individual problem or a community problem that facilitates this. And, you know, a more perverse kind of way of looking at it is that CSA runs in the genes, that it's this intergenerational thing that, you know, it just happens within that family. And there's no doubt that, you know, things that happen within our family carry through in generations, but, you know, labeling it as such that, you know, sexual abuse runs in the genes is just a kind of a way to remove some of the blame for the perpetrator. Some perpetrator stereotypes as myths. Only males commit sexual abuse. Not true. Some females do, about 5%. Dirty old men. Not true at all. Only mentally ill people. Again, not true. People of lower socioeconomic status. Individuals who abuse drugs or alcohol, although this is a precondition for pedophiles, definitely, and probably for some. It facilitates it a little more, but it doesn't cause it. And kind of the idea that, well, if an abuser lived in my home or community, we would know about it. I would know about it. And I think what's important, Murray does a really good job of summing this up. A common misperception about child sexual abuse is that it's a rare event perpetrated against girls by male strangers in poor inner city areas. To the contrary, child sexual abuse is a much too common occurrence that results in harm to millions of children, boys and girls alike, in large and small communities and across a range of cultures and socioeconomic backgrounds. These acts are perpetrated by many types of offenders, including men and women, strangers, trusted family or friends, and people of all sexual orientations, socioeconomic classes, and cultural backgrounds. And so this is just a perfect summary. There is no one type. So just a few more facts before we move on. So kind of the opposite of myths. And I really want to explain here how much sort of guilt I have about how we practiced in the early 2000s, because we didn't recognize a lot of this kind of as research was really just starting to emerge. Contrary to what we believed at the time, most offenders are also attracted to adults. So simply being, you know, if you offend against a child, that doesn't mean you don't also have sexual attraction to adults. Many offenders abuse both children and adults. So they can abuse children and they can perpetrate sexual assault on adults. Many offenders abuse both girls and boys. So we used to think, well, it's just one at risk and not the other. Absolutely untrue, although it is true that some offenders have a type, especially pedophiles who prefer boys. Many offenders abuse children within and outside of their family. So again, because someone's committed a sexual offense outside of the family does not mean that people within the family are safe, and vice versa. And the idea of not all offenders are pedophiles. There's a definition for what pedophilia is, and not all offenders meet that criteria. Just to know that most offenders began their sexual offending behaviors in adolescence. And one of the saddest parts, and people coming here from victim services or who are involved in court and child welfare will know this, the vast majority of cases are not prosecuted, and very few result in conviction. And I do think things are getting better, and I want to talk about this a little bit later, because I think we still need to provide and encourage a safe space for disclosure. When you ask people who have disclosed, many of them would not do so again. So, if you were to talk to people who went forward, who made the allegation, who, and I had many of these examples, who basically got put through the ringer, who were accused of lying, whose reputations were questioned, whose families rejected them, where defense lawyers employed terrible tactics, why would they report this again? All right, so now let's talk about the scope of the problem and some of the impacts. I want to keep track of the time here. Maybe if you can just maybe give me 5 minutes before you think I should stop, Ashley, that would be wonderful. So how many children are affected? So this is a really, I want to be cautious about giving you numbers because studies are wildly vary. It depends about your sample. It depends where you are in the world. So what I'm giving you right now is worldwide prevalence. So two incredible studies looked at the how much this occurs. So these are self-reports. So people saying, I was abused as a child. And so what basically it was found was 12% of boys and girls. So 1 in every 8 child. Girls, much higher prevalence, although there is some question as to the fact that they are probably more likely to disclose for a number of reasons. I'm going to say here about 1 in 4. We hear 1 in 3. We hear 1 in 2. We hear 1 in 8. I think it's just important for us to understand that it's extremely common. And boys, a little bit less common, probably about 1 in 10. But again, it depends on the study. But I want to talk about clinical samples. So a clinical sample, for those of you who aren't in that world, I'm just moving my thing around so I can see. Clinical samples tend to be where we're involved for a certain reason. There's some behavioral, psychological, or other issues involved. So just going back to some of the studies that I carried out, in my sample, 38% had been abused of boys and girls together, and 20 to 25% of these kids, so 1 in 5 to 1 in 4, acknowledged it was in the severe to extreme range of abuse. So certain responses to the questions they gave, the authors of the measure, qualified as severe to extreme. And so we need to really pay attention to that. Girls, though, far higher disclosure rates. So I had 64%, 68%, depending on my samples. Boys slightly lower, but still, we need to be concerned about this. These are higher rates than what we would see in the general population, which is what I was talking about earlier. And if we look at studies around child prostitutes, I don't even like that word, but let's say trafficked girls and individuals, studies on these and incarcerated youth, homeless youth are extraordinarily high. And so these particular individuals have experienced this at a much higher rate. And I would suggest that that's usually how they, end up in these scenarios. So in contrast to prevalence studies, so again, these are reports of people saying this happened to me, either a child, an adolescent, or an adult kind of retrospectively reporting. Official reports that go to child welfare or to police are about 30 times lower. And so I almost want to beg you, don't pay attention. So you'll look at the Canadian Incidence Study of Abuse and Neglect. Yes, sexual abuse is far more rare compared to the other types of reports, but it's really really dilutes what the actual problem is, because far fewer of these cases come to the attention, and these reports tend to be very much about what happened at that particular time that case got brought to child welfare, and it's very often for another type of abuse or neglect that's more obvious. The risk of sexual abuse rises with age. The highest risk is between 12 and 17 years of age. Girls, it tends to come earlier and last longer. Boys, usually later, but for a shorter duration. And this very disturbing statistic around forced intercourse. So what are some of the impacts? So I talked about signs and symptoms, and these relate to the impacts. So I wanted to let you know that almost all of these impacts that I'm talking about here come from what's called a meta-analysis, which basically pulled together 217 different studies with combined samples of 10 million people. So this, I think that we can be very confident that these are evidence-based impacts or outcomes of child sexual abuse. So the first category of psychosocial problems, substance misuse. So this is has the strongest, I guess, evidence base. Delinquency, problems at school, conduct or behavioral disorders. Things like risky sexual behavior, sex work, and sexual re-victimization in adulthood. So 2 to 3 times the risk. So adults who are sexually assaulted in adulthood, it doesn't mean you were sexually abused as a child, but there is a 2 to 3 higher risk that you will be sexually re-victimized in adulthood. Sexual offending behaviors, again, really important when we hear this research, so we're careful. If you sexually offend, it doesn't necessarily mean you were sexually abused, there's just a higher likelihood. But being abused as a child does not mean you're going to go on to later offending. Okay, so to not make that assumption or that link. And then other impacts like self-harm, again, non-suicidal self-injury, suicide, suicidality, so suicide behaviors, as well as suicide itself. Some psychological and psychiatric disorders, such as the most common post-traumatic stress disorder, schizophrenia. Both of those have very strong connections in the research. Depression, anxiety, dissociation, bipolar disorder, and eating disorders. Some physical health diagnoses, so things like obesity. And I just wanted to stop here. For those of you, you're probably hearing more and more all the time about the ACEs study, and I'm really appreciating that there is so much talk about it because it's a landmark study that I think has really opened our eyes to how common abuse and neglect are even in the general population. And this dose-response relationship of the more things happen to you, the worse the outcomes for you, essentially. But how the study even came to be was as a result of a group of obese adults who were receiving treatment in a physical health setting. And what they started to recognize when they dug deep around the obesity and started connecting it with people having gained weight, as a result of not wanting people to touch them, or people who were turning to food as a result of their experiences. This real strong connection with child sexual abuse is actually what pushed forward this study. So I thought that was kind of an interesting backstory to this. As I said earlier, pains in the stomach, so gastrointestinal issues, fibromyalgia, which we hear a lot, kind of unexplained pain and conversion disorder, which are different problems within the body. And HIV as a physical health diagnosis. And really that the high number and high severity of abuse and neglect leads to more harmful effects. Now, I'm studying right now the neurobiological impacts, so I want to just talk for a second about the brain. So what happens when we are traumatized and what tends to be more severe for sexual abuse is that there are actual impacts on our brain. And so this is really important because what that does is has cascading effects on our development in many different ways that that impact different ways of functioning. So I just want to, really impress that actual genetic, actual biological changes in our body occur. People who've been victimized will show inside stress hormone responses, advanced puberty, within their bodies, and really look very similar to people who were exposed to war. And so it's important for us to really understand that the actual neurobiological and physiological effects within our bodies, mostly related to stress hormones. And going way back to 85, but I think it's important, is understanding that child sexual abuse, the reason why it can be so harmful beyond any kind of physical impacts are the powerlessness that many victims feel, the blame that's attributed to themselves, the way that they look at sexuality and their own sexualization in kind of a traumatized way, and just that feeling of betrayal. Because as I mentioned, for most, it occurred in the context of a relationship with someone they trusted. Okay, I'm not going to get into details about this here. I just really want to show you this line down the middle here. Basically what this shows is this is a decreased risk of outcome after exposure to child sexual abuse. And this is the increased odds of having a particular outcome after child sexual abuse. And you could see here this massive list of outcomes, many of them I listed, and what the odds are all along here. So, you know, a 1.2 times the odd, 1.5 times, 1.6 times, and in this case, 3.4 times the odd. And so you can really see really the impacts that sexual abuse can have. And just, you know, if we're not going to focus on just the pain and suffering that's associated with child sexual abuse, we can look at the economic burden of child sexual abuse, which has been estimated at about, you know, probably today about $10 billion. And the average lifetime cost for victims of child sexual abuse, you know, in the hundreds of thousands. And again, I think these are very crude measures, and I'm not sure they even come close to capturing what the, you know, long-term costs are. If you think about all the outcomes that get impacted in various domains. What I want to talk about though, because we're always talking about pathology, and I also want to talk about, you know, that for some, and for many actually, they don't show any clinical symptoms at disclosure, and some kids actually may never show any symptoms even into adulthood. And, you know, we need to understand this in the context of there are so many different characteristics associated with each child sexual abuse incident or pattern. There are so many different outcomes, and all of us have very different, I hate to say resilience as an individual thing, because I think there's some blowback about resilience because of this, but internally we have different strategies that have been enhanced by what's around us. So much of how we do and how we respond has to do with what is around us in our families, what's around us in our communities. And so really, later when we're talking about prevention and intervention, this is where we need to focus. And so here, the number one primary factor of adjustment post-child sexual abuse is support from the non-offending parent. So you need the parent if it happens in the home, or the parents if it happens outside of the home, to believe and to support. And what we always used to say to parents was, because it's very, very normal for the first response to be denial. Like, how could this have happened? There's no way it happened, or how could I have let this occur? I would have known, is to beg parents that even if they don't believe now, to please show belief and support for the now. We'll talk later, because it's extremely rare that that a child makes a false report. In fact, it's far more common to not report at all, or to absolutely minimize the event. Other factors that influence resilience is that if the person hasn't experienced abuse before and doesn't experience future abuse, here in terms of re-victimization, and really just feeling good and satisfied within their communities. So who they are as people, their social role within the community. Some other associated protective factors are level of education around what sexual abuse means, as well as just education, period. One's interpersonal and emotional competencies, belief that you have within your life, so this internal locus of control that you have, that you can manage, you know, yourself, that you've got agency, your ability to cope and to show this active coping. Optimism, you know, I hate to put it that way, but hope and optimism, I think, has been really demonstrated in many contexts to really help our recovery. Our attachments to social relationships is hugely important, and our ability to place the blame elsewhere. And a lot of this comes out when kids are engaged in cognitive behavioral therapy and trauma-focused cognitive behavioral therapy, where they're able to sort of change the way that they're thinking about what's happened and externalize that outwards. And really, as I said earlier, crucial that there's support from the family and the wider social environment, including all of you as, you know, as professionals or as family members or as friends. Again, it's much more common to delay or never tell than to disclose right away. The average time from first incident to disclosure is 15 years, if they do disclose at all. So we absolutely need to be paying attention to this. There are some studies to report that, you know, kids will disclose more often until about 11 years. And then there's kind of this period in the pre-adolescent, early adolescent period where they don't disclose. And then to disclose again at the age of 16. And then for people to do some disclosure in adulthood. And this again is impacted by many factors. It could be how severe the abuse was. It could be, and very often is related to the type of relationship between the child and the alleged offender, the offender's history of violence, so previous violence, so if they're scaring the child in some way, and any previous disclosures that they may have made in the past. And again, some groups are less likely to disclose. Again, suspects with violent offending histories are kids who've been exposed to that level of violent offending or are really afraid of that individual are much more likely to disclose. And I'll just talk about that for a minute before I continue in terms of the lengths to which many offenders will go to have the individual not tell. And that can be from subtle manipulation, subtle comments to very overt, if you tell, I will do the following, or a family will be destroyed, or your mother will kill herself, or I'll kill myself, or, you know, all kinds of things. We need to be really cognizant, like, you know, in the way that we question why women don't leave abusive relationships, or why survivors of IPV, I should say, don't leave. There are all kinds of reasons that most of us will never fully understand. Some secret keeping tactics for survivors. So just so we understand that, you know, like with any type of trauma, we adopt certain ways of adapting that help us to cope. And that could be presenting to the public a very normal persona. Or at the other end, that we could be presenting a very unstable identity. So giving out to the public, like we're crazy, we're disturbed, and really shift the focus away onto this other piece so that you don't have to talk about or have people pay attention to the sexual abuse. Presenting different personas depending on who you're around. Reframing the abuse, so minimizing it or looking at it in a different way, either to yourself or publicly, that, you know, it kind of wasn't a big deal or it wasn't really abuse, it was their way of showing me affection and love. Concealing any trace of it after the disclosure, so finding ways to just either deny that, you know, it happened, or to, you know, remove any evidence that may have indicated the abuse. And making a monument of the abuser. So essentially saying, you know, what a wonderful person my uncle is, and wow, my mother is just such a fantastic person. And that's really an adaptive coping mechanism that we need to, you know, recognize as being, you know, a tactic. And just very quickly, disclosure. I mentioned earlier, it's so important for us to understand that disclosure is a process. It's iterative, it continues around, it's interactive with different people. It's almost always not a one-time event. And I think this flies against how I traditionally was involved in all my years of child welfare, and even today. We had this idea that we were going to bring a child to the police station and we were going to interview them once. We were very worried, and so we should be, about tainting interviews. We were worried that if we re-interviewed too many times that we might plant ideas, this idea of planting memories and ideas, and there is no doubt there's concern about that. But what we need to recognize is that most children do not disclose, and even adults do not disclose everything at the same time. Disclosure is best done within a relational context, and you will find that many kids will actually disclose to their peers first. to people that they feel that they can trust. And it is better that way because there is a much more likely positive response, which I was mentioning is a huge indicator for how one manages and is able to function afterwards. Age and gender significantly influence disclosure, as I mentioned, kind of up to 11 and then, a little bit more in the teen years. And gender, females are more likely to disclose than males. And I think we can all assume there are many different reasons, but, there's still this kind of idea of if I disclose as a boy, I'm not tough. If I disclose as a boy, people are going to think I'm gay. So this whole idea around that piece. And the disclosure models that we want to really look at need to reflect a socio-ecological person in environment kind of context, because we need to understand there are so many different factors that surround this child that can really impact how or if the disclosure takes place. And just, to impress that there are still more barriers to disclosure than there are facilitators, so things that actually can help a child's disclosure. So I thought I would just, maybe some of you in this room are wanting to know what happens if a child discloses to you. It is indeed a very uncomfortable situation, and so many of us aren't really quite sure what to do. And I'll do my best, but I really want to invite people who are in the audience today to also share their perspectives. It's from a purely kind of case management review, we want to first ensure the safety of that child. So ensuring that that child is in a safe environment right now and will be later. That the situation is reported, and we need to talk about this because I talked about people not wanting to report, and there is this notion of trust, a relationship that they have with you, and maybe having to break that trust. But it is extremely important for a number of reasons that this does get reported, and we'll talk about this in a minute. That we ensure the mental health of the child and their family. That we make sure, regardless of the disclosure, that we do physical examination. So this is really important to make sure that they're doing okay, and that we also do a forensic evaluation that can often include the police. So depending on the disclosure, but most often we need to take care of these 5 areas. So what should you do if someone discloses to you? So as I said, many of you are probably professionals in the community or teachers. Even if you're a family member or a friend or a parent, the best thing to do is to listen. Don't interrupt or stop them from talking. Oh, no, I don't want to hear it. Or wait, we should call so-and-so in. Wait, I should call Child and Family Services. Don't. Please let that person provide their full narrative to you until they're ready to stop. Don't interject. As I said, don't stop the disclosure in progress, because you may have been the first person who is hearing this, which is important to the child to be heard, but it's also could be important in terms of evidence, actually. Many of us know active listening techniques, so really making sure that you're maintaining eye contact and not looking away, making them feel even more uncomfortable, nodding, making sounds that you're hearing what they're saying. You can encourage kids to continue, but don't press them. If they stop and they're not comfortable, please don't press them. We're so curious sometimes, especially as investigators, and we want to know, we want to protect the child, but it's really not helpful to the child for the reasons I mentioned earlier around it being so important how comfortable kids are in their process of disclosure. Ask if they've shared this with anyone else before, because I think, again, this is really important for you to know when you make your report. It's important in terms of the investigation. Really good to thank them for sharing this with you. That the information they shared is really important, and that you will not be able to keep this a secret. So many kids have heard about secrets, and you need to explain that you can't keep it a secret, and that you need to tell someone who can help, but that you're only going to tell people who need to know. And again, thanks for sharing. This must have been really hard for you to do with me today. And one of the hardest things to do is to not show shock or feelings of disgust, any other strong emotions, and that includes crying. I think that can be really, really difficult, but we really need to not further stigmatize this for kids. And I would just suggest that the best thing to do, most of you work in places that have policies, really the best thing to do is if you're not a supervisor or director yourself, to report to them first, and then to make a decision together to report to Child Protection Services or to the police. So now I'm just going to spend a few minutes on promising approaches, and then we can have a nice discussion. So in terms of prevention, you know, this is really, there's a whole article that I read that reviewed parent-focused prevention programs. This is really important because I think that we have taken we've removed the involvement or the responsibility, or I don't know how to put it, but away from families and parents. And we've left parents sometimes feeling that if they talk about certain things like this, that somehow they're going to disturb their child, or that it may give them ideas, or they just have a lack of, you know, understanding themselves about it. So really, we need to be aware that that is the best place for a child to be learning about what's appropriate and what's not, what their bodies, you know, mean, and that the body is their own, and what they can say and what they can do, and basically who they can trust. But even to talk about that, sometimes people that I think, you know, you can trust may not be people that you can trust. And so please, you know, you can always share these things with me, and not to keep secrets. This whole, I catch myself with kids sometimes like, oh, don't tell your mom I gave you that thing. Really doing our best not to even have secrets as something that is part of our language, because that further impresses the feeling of the child not to share this. There are many school-based prevention programs. I just heard about a wonderful one here in Saskatoon called I'm the Boss of Me, that's carried out by the Sexual Assault and Information Center here in Saskatoon. And I believe it's trained, you know, thousands and thousands of children for the last decade at least. And this year, I believe, reached 100 of the public schools here. So this is for grade 4 children. It's a puppet show. And what sounds really interesting about it is the discussion about the body, the discussion about child sexual abuse to kind of bring it into the light. And just the whole nature of that this young person was sharing her story with a friend, and or that the friend suspected that maybe something was going on, because it is really important for kids to be able to help each other. So it's not just about you as a survivor, but you as an ally or a friend. And the review of school-based prevention programs are really promising. So there's improvements in a child's ability to feel protective, evidence of increased knowledge that, you know, when they checked about 6 months later doesn't deteriorate, that participation does not lead to increased or decreased anxiety or fear. So, you know, it doesn't make them less afraid or more afraid, but it just makes them more informed. And that there's some evidence that participation can increase the odds of disclosure, but that's not quite clear. And I think some of these programs are really trying to figure out ways, how can we follow up to see if this happened in a way that, you know, is possible and makes sense. But as you can imagine, that would be really, really challenging. So just a note here, children's increased knowledge of abuse should not be seen as a replacement for society's responsibility to ensure child safety. It must be emphasized that increasing children's knowledge in this area does not mean they're in any way responsible for the abuse, which might then occur by their not being able to apply this knowledge in an actual abuse situation. There's a spelling mistake there, I realize. So just to impress this piece, there was some concern about school-based prevention programs in that it would, you know, if a child did get abused again, that they would feel even more guilty. You know, that somehow they knew about it, but they still didn't stop it. And this is what needs to be impressed as well, is that, you know, sometimes you just can't. Sometimes you can't stop the abuse from happening. You can know about it and still not be able to stop it, but it's not your fault. In terms of interventions, therapeutic approaches, by far the most evidence-based and the most common are cognitive behavioral therapy and trauma-focused cognitive behavioral therapy. And, you know, but how effective these therapeutic approaches really has to do with, you know, the type of the program, how long it lasts. So usually longer programs do last better. the inclusion of a caregiver. So I used to be so frustrated when I worked in Quebec that, you know, for kids to get treatment, they had to bring with them their parent, their non-offending parent, or their foster caregiver. And if they weren't able to do that, they couldn't get treatment. But the idea was that, you know, for the treatment to really help, it needs to be carried through and be consistent with what's happening in the environment. So it definitely, there has been evidence that including a caregiver does improve outcomes, as well as age, gender, and ethnicity, contributing to a variety of different outcomes on how effective these approaches are. I mentioned already longer interventions are associated with greater treatment gains, and group and individual treatments are equally effective. And I think this is surprising for people when they think of running groups for kids or for adolescents or even adults, that somehow sharing with other people is going to be really difficult, that people aren't going to want to talk. But like with many other problems or issues, having people who've experienced what you have in the same room with you can be really, really rewarding for that individual. And just to note some for preventative and clinical interventions, we need to make sure that we're adapting these strategies, paying attention to the child's developmental level. What I really want to stress is that this sort of 1 hour therapy a week that we've been looking at for years, Bruce Perry will tell you, he's a neuroscientist who you know, is really focused on the impacts of trauma on the brain, will tell you this 1 hour a week really isn't enough. And the other thing that we need to understand is some children, adolescents, and adults will not respond to cognitive-based treatments or approaches, whether it's in the classroom and you're telling someone to sit still, whether you're doing talk therapy. So there are many, many other types of strategies that can be employed with children who are severely dysregulated as a result of abuse. You know, therapy approaches that do things in a completely different way, that has to do with music, drumming, yoga, meditation, other types of mindfulness, other types of practices that don't rely on one's kind of cognitive or developmental abilities. And really very important that we really push for these families to get more social support from the people that are around them in their lives. And I just want to talk about the fact that we have victim services and supports here in Saskatchewan. We've got children's justice centers in most other places in Canada, and in every state in the US, they have what are called child advocacy centers, which are wonderful, wonderful environments, and like a real move in the right direction, because it involves a welcoming center where kids can come after a disclosure of sexual abuse or severe physical abuse, where you have the social worker, a mental health practitioner, a medical doctor, lawyers, so a number of different professionals there all at the same time, so that the child isn't sent in a million different directions, where any evidence that's gained through an interview that's done well is done so in the presence of other people, and where you really get this multidisciplinary approach to dealing with sexual abuse. There are many good evidence-based interviewing techniques. So those of you who receive the disclosure, don't worry, you don't need to know them, but people who are interviewing kids absolutely need to be trained in how to conduct these interviews. And, you know, just to let you know, as a social worker, I sat in the other room and watched police interviews in progress. And really, sometimes we as the social worker may know things that the police officer doesn't, may know things about the child's development, or may even just think about things or pick up on things that the interviewer didn't. None of us are perfect. But these evidence-based interviewing techniques really rely on, you know, first of all, having the child get comfortable in the environment, and then doing some talking about telling the truth and not telling the truth, giving some examples of what that could mean, giving the child some examples to promote free narrative around non-abuse related topics, and then gradually going into kind of more open-ended type of questioning around the abuse itself. And I really want to acknowledge, I saw so many of you coming from many different organizations, and I know that many of you provide supports to these children and to their families. And so we do have many wonderful services and supports here. Most of all, though, listening, supporting, and believing is almost more important than our therapeutic approach. It really, really is important. And even if you're having a hard time with it, please fake it. Very, very few children and adolescents are untruthful. It's extremely rare, and we need to get away from that myth because I think it's been extraordinarily damaging. Just a quick, I told patients I might talk about the Child Trauma Research Center, but I just really want to do it in the context of, I'm a kind of an expert in residence this year. Dr. Natalie Reed, I believe she may be on the call now, I'm not 100% sure, is the director of the Child Trauma Research Center. And my colleagues Chantel and Rashik, I think, were able to join us today as well. And we really, we've spent the last year developing a website, mostly related to COVID-19, but where we've done a huge review of what literature and resources are out there and kind of came up with these over 100 resources. So information briefs and posters on a bunch of different topics. You can go to this website here. But specific to this topic, we've got one on online child exploitation, as I spoke about earlier. So what are the facts and what are some suggestions about how to respond depending on the kids' ages, how to respond to disclosures. So just some good tips there. And just really regulations and contact information for how to actually make those reports. So those are 3 of dozens and dozens and dozens that we have on a variety of different topics. And so we encourage you to go to this center if you have the chance. I'm not going to summarize the key points except just to say this is a global problem. And let's take advantage of globalization right now in technology to, acknowledge that we've got increases in different types of abuse, but also to use it in ways to help support and to hopefully work towards diminishing child sexual abuse. Just very quickly, there is a downward trend. We're not really sure that it's a real decrease. It could be less disclosing, but I do feel as though we've really come a long way in the last 40 or 50 years. And we've come a long way in terms of our therapies being more effective. But what we need to do is take what's happening, what the researchers are doing with little studies and actually moving that out into the practice world. And I would say probably more than anything, focusing on prevention. How can we set things up for us in our society, in our families, in our communities, in order to have this a far less likely occurrence? What we know about child sexual abuse, what we share with each other, the culture of belief and safety we create will all influence child well-being around child sexual abuse. So I'm tired of hearing my own voice, as I always am after these presentations, and I'd love to hear from some of you and what some of your questions might be. I have several references here as well. I'm going to actually, there's a few missing, so before we send out the final presentation, I will fill these in for you, but I just wanted to acknowledge all of these wonderful resources.
Thank you so much, Lise, for that very informative presentation. I think we all have a couple or many takeaways from it. So I'm going to pass it off to Christina, who is our Q&A moderator right now, and we're going to open the floor for questions.
Awesome. Yes. So I have opened the chat for questions. So if you want to leave your question, if you're comfortable doing that for everyone, feel free to type it in there. Or if you are comfortable and brave, you can ask your question via the video and audio. So just raise your clapping hands emoji so that we can see your question. It's just in the reactions at the bottom of your screen. So in the meantime, as the questions are kind of continuing to flow in, so I guess one of the questions that I have for you, Lise, is about kind of what we're talking about this week with regard to communities of care, creating cultures of belief. And I think all of us, all human beings, whether we interact with children in our professional lives or just surrounded by them personally, be they children, or, we're our nieces and nephews, or family friends, or we coach, or things like that. And so how, beyond just our professional relationship with children, can we ensure that we have a responsibility in preventing child sexual abuse, just as people who are part of a community. And how can we empower community caregivers regardless of who they are in that relationship to the child? How can we empower them to not shut down a disclosure, but to be that trusted person in a child's life, and sort of recognize that almost sacredness, and that a child chose you because they trust you or something about you, that they could make this disclosure? So do you have any thoughts or feedback?
I think it comes down to what I was describing earlier, is just, creating basically a culture of belief. So, and so that goes within your family setting and goes, into the wider community. But the idea being that, I think we underestimate children big time. First of all, they know more than we think they do. Second of all, their language is actually really quite incredible, even at very early ages. And I think that we, I shouldn't say we, I think parenting has changed a lot over the years. But I think that there's, often kids feel as though we're sort of half paying attention to what they say, because they say so much. I mean, sometimes they're telling incredible stories, and, and they go into fantasies about things based on things that they've seen. But I think when kids feel like what they say matters, so in an everyday context, when they have this, feeling that most of the time when they're approaching their parents or their caregivers, that it's received in a positive way, they're going to be far more likely to want to share that with you. When there aren't other secrets being kept within the family, when we don't use that language of secrets, and that's really difficult. I'm aware of that. I mean, coming from privileged homes and communities, it's a lot easier said than done. We know that many people are in marginalized situations that, but to the best of your ability to be able to provide that. I want to talk about resilience a little bit, because we talked about it here. And again, my field, I've been saying this a couple of times lately, but I'm kind of, the words that are used in my field around trauma, around resilience, being part of the Child Trauma Research Center, my colleague, Dr. Natalie Reed, it's like, there's a lot of pushback about those words. And the reason is because there's a lot of kind of an individualized focus about it, rather than looking at what conditions are around a child or an individual that can build or enhance that resilience. It's much more important than what's around a child, that's what's within a child. And so for us to also have that awareness about, all of the different things that we say and do around us that can create positive conditions for kids, and so, I mean, I guess that's what I would say, as generally speaking, and more specifically, what's happening today. What's happening today is a bunch of people have joined to learn about this. And I have made an effort to learn about this to kind of get to this stage. And it's that awareness, that willingness to learn about, particularly about a subject that is extremely disturbing to many of us. There's many people here today who are probably feeling very heavy-hearted feelings, and it's really, really common. And so, it's a challenge that we, unfortunately, I think we need to overcome and kind of move beyond, because I think we subtly, by not asking about things, subtly by not providing open environments, we reinforce the stigma that still surrounds child sexual abuse. That we reinforce that it's probably not the best thing for kids to tell. Yeah, and I think that, even, the environment that we're in, whether it's professional or personal, being able to make sure that whatever we're doing with kids is thought out really well. So all the steps that we take, we're always considering the child and the child first, and not our own desire to get a disclosure, desire to get a conviction, desire to, rather that we're setting things up, because it's far more important for that child that they were believed, that they felt supported, than that there was a conviction, really, to put it bluntly. I'll stop there.
No, that's great. We have a few questions. Erica, I did see your clap emoji hands, but I had someone beat you in messaging me, so we'll get to you in a minute. So kind of speaking to kind of the tail of what you were speaking to Lise about disclosures and creating this environment for children culturally and socially. One of the questions that came in was from someone who said they're facilitating a youth group for girls. At the beginning, they talked about the mandate of duty to report if anyone discloses sexual abuse. And then from just that opening of the conversation, one of the girls began to ask, what happens if your uncle is abusing you, but you're afraid to tell? And then this individual had many detailed questions, but then said, oh, it didn't happen to me. I was just wondering. And then this individual then made a report based on this information to authorities, but an investigation wasn't started based off of this third-party information. And so just sort of being upset that this girl could be continuing to be abused and did try to tell somebody, did try to kind of figure out and navigate and recognizing that what was happening isn't wrong. So, and then those feelings of helplessness of like, I did what I was supposed to do, and just feeling like then this individual could be continuing to be abused. So, I mean, could you speak to that, even that sort of like disconnect between systems sometimes and yeah.
Sure, and that's such a great example because it goes to some of the stuff that I was talking about earlier around disclosure and how it's a process. And there's people who won't agree with me on this because disclosure is associated with more positive outcomes. Earlier disclosure is associated with better outcomes, but it's not our job to decide, you know, when that's going to be. And it can be so frustrating because, you know, she could be referring to a friend, a sister, you know, she could have heard a story. She could be talking about herself, very likely is, but that's her way of testing the waters. Like, and that's the beginnings of that process of disclosure. Because within us, the trauma that's experienced within your body and within your brain is so complex. And the way that we adapt is so complex. That, you know, putting out those little pieces is, you know, our safe way to, as I said, test the water, see what the response is. So the best thing to do in that scenario, and I'm sure this person did, was to accept it, to hear it, to understand it, to believe that this, you know, could have been a possibility. I appreciate that the person reached out to child protection. Having worked there, what I can tell you is, unless there's a specific disclosure, or, you know, so many factors are considered, like the age of the child and the, you know, the vulnerability level of the child, and many other factors come into play. But, you know, not all reports are pursued. So when we suggest that you make the report, I do it for everyone. If you just want to know, most reports that are received for information purposes. I don't even know their name, but I want to know, or I have these details, but I don't have a bunch of details, or, you know, they'll say to you, can you go back and get more information and come back again? But we're not always happy with the way that child protection proceeds in these situations. And I think, you know, it doesn't, I hope that people don't get discouraged. It means that they're weighing the reality of how they might pursue this. And I think an important piece is the respect and consideration for this particular girl, you know, and the hope that you've provided enough of a positive response and maybe can do some, you know, background work to ensure safety in different ways, you know, to ensure that there are other trusting relationships in that person's life so that they may feel comfortable to disclose again. People forced to disclose, people who, you know, even in adulthood, when they say, like when they, you know, I have a friend who was abused by her father, she didn't disclose. And when she did, not long ago, she actually absolutely regressed. And so, and that doesn't mean she won't do better later, but definitely there was a huge regression and she regretted talking about it. She regretted confronting her father. She regretted sharing it with her mother. So these are things that are like, you know, we really have to be mindful of how complex this is. Yeah, so I'll stop there in that question too, because I know I'm mindful of the time.
No, definitely. And it speaks to the uniqueness of how people process things too, right? And we can't, just because we think something is best for us isn't necessarily mean that's what's best for that individual. And so Erica was brave and she had her clap emoji hands. So if you want to unmute yourself and ask your question.
Yeah, and I guess it was more, I wanted to add something to our previous question about Lise talking about the culture of belief. And I was wondering if we could maybe all chat about how we can shift or how we can add the culture of understanding. So I think as family members, as people who run programs, as people in education maybe, we need to talk about how we can help our kids understand consent and understand their bodies and use appropriate language, like so that they can talk about their penis or vagina and they don't have to think that those things are bad words. So how we can start to incorporate some of those spaces where people feel safe disclosing, like you said, like it might not be a special individual, but it might just be creating those spaces where children can understand that it's safe to talk about these things.
Thanks, Erica. That's such a good point, because belief and understanding, and I didn't mean to use the crude word of fake it till you make it kind of thing, but you know, it is definitely important for us to show that we believe what someone has told us. But you're absolutely right, and this is the whole idea behind education. It's not it's not the job of the child welfare worker. It's not the job just of the teacher to know about this stuff. It's the job of everybody in society. Everyone has a legal mandate to report child sexual abuse. There are other, you know, the laws vary provincially across the country because child welfare is a provincial law, but every law states that sexual abuse must be reported even by a citizen. So we all need to understand it. And I think, you know, I used to do all my presentations with this iceberg kind of phenomenon. I have one slide around the scope here, and that's because, you know, if proportionally speaking, this is what we know and this is what we don't know and what we don't hear about. And that's because there is still up here this kind of like denial of this as a problem. Just look at the scope of the problem, you know, and I don't like to make people feel uncomfortable by saying, look in that room and eight of those people have been abused. You know, maybe no one's been abused, but that's the statistic. And so, you know, to really like be like you said, Erica, talking about this as though it's, you know, not something to be ashamed about. And maybe, you know, I don't have little ones in my house right now, but, you know, kids get obsessed after, like, during periods talking about genitals, and then we're like, oh, shh, you know, and they giggle and think it's really funny. And to some degree it is, but, you know, we really tell them to keep that stuff to themselves. You put that away, you know, and so I think also even that, like that whole idea that it is part of their body, it belongs to them, that they're okay to talk about it. And that will remove, I think, some of the shame and around it, but also, you know, make them feel a bit more comfortable talking about this thing, because I think it is this, we experience it so differently, that kind of self-disgust, because it has to do with sex and it has to do with genitals, and, you know, often, and things that we kind of tell people not to talk about. So yes, I really appreciate what you're saying, Erica. You know, it's not just believing, it's really understanding and knowing more about this. And, you know, knowing more about how we can prevent it, knowing more about how we can intervene. Thanks.
Excellent. And we'll go with one last question to wrap things up here. So even as you were saying, kind of adults struggle sometimes using that regular word, anatomical words for body parts, right? Talking about sex or those types of things, right? So to receive something then that is sexual violence from a child, even more so, kind of throws us off. And so added to that, and then is the layer of, all too often, caregivers also have historical experiences and need support. And so highlighted by one of the participants today was how can we engage caregivers who also have these histories and potentially might need their own support, whether they're that immediate caregiver of the child or just someone peripherally who's receiving those disclosures or walking through this journey with the child.
Really important to understand, because as I mentioned earlier, you know, many types of trauma are intergenerational. you know, I feel again like there's this element of shame, and then I try to forgive myself about how, you know, we learn, we grow, you know, through the years. But boy, did I make judgments about the parents of kids who were abused. Did I ever make judgments about the woman who was abused by her father, who then allowed her child to have access to her father? You know, she talked about her own victimization and wasn't able to make that connection to the victimization of her child. I worked for many years with a young girl who, this is a terrible story, but I think it's important because it speaks to so many different things. But I would spend time with her, kind of provide respite for her foster parent, and supervise visits with her mother. Her mother had schizophrenia, was severely obese, and this young girl was actually the daughter of her grandfather, right? And so there was this abuse of a woman who then got pregnant, who had this child who was having severe issues. It's the onset of schizophrenia, which is very common. It's, again, not to say if schizophrenia is due to, but that there's a high risk of it. And just that whole kind of nature of how did we expect this caregiver, given their own histories, to be able to provide good care to their children. You know, often they've been so marginalized. As I talked about earlier, the impacts of trauma are so far reaching that go beyond a cognitive level. And so, you know, I like what you're saying around, and Margaret Blostein, who she was just presenting at a complex trauma conference we had, but she was really, really talking about how important it is to connect with caregivers. Stop, and I used to do this too, and we still do this, ignoring the parent, ignoring, like having conversations without them in the room, as though they don't matter, as though they're not included, you know, showing respect, being honest, being upfront, showing our support for them. This must be really hard for you. This must be incredibly difficult. Shifting blame to where blame belongs, which is not with them. And that's a whole other story, even if we talk about offenders, because I see them as human beings. I was able to work with them and talk to them and not have some of the, you know, reactions that some of my colleagues had, because I think they themselves suffer in ways, you know, but let's keep the focus where we need to, which is, you know, having the child and the caregiver supported. You know, if for no other reason than if that caregiver isn't supported, that we won't get very far with the child. And just really acknowledging, and us, like we need to have more humility and just open ourselves up to the reality that, you know, people act how they act for reasons, and people do what they do for reasons. And, you know, you can help shift that. But, you know, to try to go in as much as possible with a non-judgmental lens, which is very hard when you're a parent of a child and you're thinking about your own child. You know, there's nothing worse, right, that you can imagine. But yeah, so that's, I mean, it's very general approaches, but that's how I think we should approach it.
No, thank you very much for your answers, Dr. Lise Milne, and I will pass the mic over to Ashley, our host, to wrap things up.
Thank you so much, Lise, for your expertise, for your time, for your energy, for all of the information that you shared with us. I know that we have taken away so many insights, even just, you know, we get into these question periods and it feels like we could go on for another hour in terms of conversation, right? But thank you so much for spending the time with us today. Thank you to everybody who's here, who's listening, wherever you're coming from, whatever role you play as a caregiver or in your profession as well. Know that you're so deeply valued and that we appreciate you for being here and all the work that you do in your communities. And just by way of us connecting, having these conversations, learning from each other, it's just so much of what we need to continue slowly moving things forward. So thank you so much to everyone. Thank you so much, Lise. And this session was also recorded. So if somebody had to pop out early, or if you'd like to come back, and this conversation will be available in the next week or so. So thank you so much, everybody, for joining us for this Lunch and Learn series. And well, take care.
Thanks, Ashley, and thanks, Christina. And yeah, I echo your sentiments. Thank you, everyone, for joining today. Yay to you for all being here and learning more. Yay. And I look forward to hearing and learning from you. I just got an invitation to the Regina Children's Justice Center, which I'm pretty excited about. So this is wonderful. Thanks. And we'll, I hope to take part in some of your other activities.